using one's own platelets to treat knee injuries, such as damaged cartilage, meniscus, and ligaments, in order to achieve regeneration and repair and restore knee function. This treatment is called platelet-rich plasma (PRP) injection. Over a decade ago, it was hailed as a knee joint savior by Western athletes. Back then, receiving a PRP injection overseas would cost around 30,000 ringgit, a sky-high price that was out of reach for many. Later on, it was discovered that PRP also had regenerative and repair effects for knee degeneration in middle-aged and elderly individuals, allowing them to avoid or delay knee replacement surgery. The good news is that the cost of PRP treatment has gradually become more affordable. A single injection now costs around 800 to 1500 ringgit, making it accessible for many. Platelets contain a large amount of growth factors, which play an important role in the body's self-healing and repair processes. However, the unfortunate knee joint is an area that lacks sufficient blood supply. For instance, the meniscus only has a few capillaries supplying blood to its edge. The situation is even worse for the middle two-thirds and the articular cartilage, as they basically have no blood supply and can only derive a tiny amount of nutrients from synovial fluid. In other words, regardless of what nutritional supplements you take, the knee joint cartilage won't receive nourishment and will only thin with age. Once injured, it lacks the ability to self-heal. The characteristic of PRP is that it only requires extracting approximately 50 ml of the patient's blood, separating and concentrating the platelets in sterile conditions, and then injecting this platelet-rich plasma, which contains growth factors and anti-inflammatory factors, into the joint cavity. PRP not only stimulates synovial cells to secrete endogenous hyaluronic acid, which helps reduce inflammation, swelling, and pain in the joint, but it also promotes the regeneration of damaged meniscus, cartilage, ligaments, and tendons, thereby achieving a rejuvenation effect on the knee. Furthermore, because PRP is not a medication but one's own blood, there are generally no rejection reactions or side effects. However, there are still some contraindications for PRP therapy, such as poorly controlled blood sugar, cancer patients, or those currently taking anticoagulant medications, which can affect the effectiveness of PRP treatment. In such cases, other options for regenerative therapy can be considered, which can still achieve the desired results for knee joint repair. Therefore, if you or your family members are facing the problem of knee pain and would like to further understand whether PRP is suitable for you, you can come to EA Clinic to get a doctor's assessment and advice.